Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to Healthcare Consumerism Radio. And we're excited about this next segment because we have a good friend of the Institute, and a member of our League of Leaders and a frequent speaker at our event joining us today to talk about a much talked about subject and maybe misunderstood subject, consumer engagement. So joining us today is Wendy Lynch, Director of Altarum Center for Consumer Choice in Healthcare. Hey, Wendy.
Hey, how are you, Doug?
I'm great. Nice to have you with us. I appreciate you taking the time to join us. Hey, for our audience's background, or in case, give us a little backgrounder on Altarum Center for Consumer Choice in Healthcare.
Sure. The center is a relatively young center, about 3 years, and Altarum supports a variety of key issues in the healthcare space. And in about 2012, we launched this center with a focus on making sure that every healthcare decision is informed by individual preferences regarding the benefits, risks, and price of care. So it was a nice parallel with the work that you all have been doing. And we've been focused on getting consumers' opinions in surveys and focus groups, and also doing some development work, which we'll talk about today.
Yeah, you're doing some interesting work around, we're going to talk about it here, around measuring consumer engagement in health. And, talk about engagement and I think the underlying assumptions that maybe we all have about engagement and how that might differ per stakeholder group.
Yes. The notion of engagement has been used a lot. That term is used a lot, and I think that I want to distinguish between employee engagement, which is your active involvement in your job and your organization. I've heard the description of employee engagement as essentially what a person will do when nobody's watching. So if you are engaged in your job and your organization, you will likely do the things that the people around you would like you to do. If you're disengaged, you may not spend your time doing the most high-value things for your work. When we talk about engagement of the individual in healthcare or health, what we're talking about is the person's active involvement in choices and activities that improve their own health and the quality of their health care. So it's a construct that I think a lot of people debate, but it's about how somebody is involved. And I would distinguish that from the customer experience efforts that are underway by a lot of people right now, because the customer experience is their perceptions of how they're treated once they're in the system. And while they're related, they're quite different things.
Yeah. So tell us what you guys are doing around the measurement of consumer engagement.
We spent about 2 years doing development work to come up with a new measure of what we're calling consumer engagement. We wanted to expand on the existing tools for a variety of reasons. So the first one was that the idea of consumerism, as everybody probably who's a listener here knows, it extends beyond the activities of when you're an active patient. So it's about the choices that you make within the system, but also outside of the system and how you make those decisions. So we wanted to expand that a little bit. We also knew that some of the standard measures were developed a decade ago, and so much has changed about how we get information and what resources we use and using the internet, that we felt like we needed to expand the definition of how somebody gets involved. And then lastly, there are a variety of different tools out there that are at different price ranges. And being a nonprofit, Altarum supported the idea of providing a tool that was available to all types of users at no cost in return for providing de-identified data back to us. So it's been a really great effort, and we launched this spring with a tool called the ACE, the Altarum Consumer Engagement Measure. and we're excited because we've had interest from a variety of folks.
So how does this work for some? I mean, how can they find it? You know, how they access it, and tell us a little more how this actually works. If I'm a consumer, can I get this through my employer? Are you going through those channels, through other channels, direct?
Yes. So we have one of our co-developers was Safeway,
okay,
the corporation, and they use it on a platform for their employees. And they actually decided to combine the ACE with biometric testing, and they've done away with their traditional HRA, which we thought was a fascinating direction to go. We also have had a couple of health plans sign on, and they're going to be using that for certain subpopulations within their covered lives. We've had 2 clinical groups looking at it to look at performance of both patients and providers, depending on how engaged the patients are in chronic disease management. And then one exciting one is a hospital system that's going to be piloting the ACE as a way to measure engagement over time and find out what predicts whether or not their people are engaged.
Now, Wendy, going back to when you all were developing this, what were some of the interesting things that you guys discovered, when pulling this all together?
Yeah, what's interesting is that out in the literature, there are quite a few examples where the authors claimed that engagement in their minds was one construct. It is one thing, and you're lower or higher on that construct, and you become more engaged or less engaged perhaps over time. And as we were analyzing data and the questions that we developed, we found some very unique subdomains, that's what we call them anyway, sub-areas that may be a little bit related, but some of them are not very strongly related at all. So what was interesting is that one of our domains called commitment, which is how actively you manage your own care when you're away from the system, so your health behaviors and biometrics, is very different than the domain we call informed choice, which is how you use information and where you go to get information. As another example, there's a domain called navigation, which is how comfortable and confident you are getting around in the system and knowing where to go and who to see. And you can kind of understand that somebody who's a really strong in commitment and they manage their lifestyle and eat right and exercise and do all those things, they may actually have a low level of navigation confidence because they haven't had a lot of experience using the system. And so we've been really pleased to see that each of the 4 domains that we've identified predict different aspects of engagement. And we think that will be very helpful for users.
Now, Wendy, when everyone's studying the literature here, how long is this tool? And you had mentioned the domains that it consists of. How long is it?
It's 21 items.
Okay.
And they all are on the same scale of strongly agree to strongly disagree. It's really quick to take. And so each domain has 5, except for commitment that has 6 items.
Now, say I'm a employer and I look to utilize this tool, do you all come in after everything is completed and help them analyze all the information?
We can do it in a variety of different ways. The questions are available at no cost. You have to sign a user agreement and agree to provide us with de-identified data. And then we give you a scoring algorithm, so you can score it yourself. And that way you can do all the analysis you want if you would like. And we provide you with some benchmarks so that you know how you are standing up against other groups. If you want us to host it, we have a very simple website, and we can do that for a very low cost. And so we'd be happy to collaborate with people in any way that they would like.
Wendy, as you look at this site, you rolled it out in the spring, correct? That's what you said earlier, you rolled it out in the spring. So what's some of the early interesting findings that you're seeing as you look at this aggregated data coming back to you?
Yeah, we did get a chance to line things up with other sorts of outcome data. Mm-hmm. I think one of the things that is reassuring is that none of the domains differ by gender, so you're equally likely, which is a good thing. And only one of the domains is related to age, and that is informed choice. And that's because we do ask about Internet use and the ways that people get information. And as you get younger, people are much more confident and apt to be nosing around to try and find information. But we do find that the commitment scale is very strongly correlated to biometric results. So, for example, those who score the highest on commitment, perhaps 90% of them are below the cutoff of 30 on BMI, whereas at the bottom range, 10% of them are a healthy weight. So that one was very strong. We do also find that our ownership domain is quite correlated with adherence to medication. So I can kind of rattle on, but basically it's a nice way to get an overview of how people are behaving and how they perceive the system and their own active involvement in the system.
Yeah, this is very interesting, Wendy, and then this ties in, it seems to tie in very nicely with the other work you do as well, correct?
Yes, we wanted to have a way that we can talk about how people change or in what areas they need more support. So, for example, Safeway, not only are they using the tool to measure people, but they're targeting their outreach based on the scores that people have. So we provide them with the scoring, and they reach out and talk to people about why they might want to ask more questions or where they can find more information. But as you guys know, we have a long way to go before consumers, as a general rule, are going to be taking an active role in their care.
Yeah, we're on the early part of that journey, correct?
Yes, the data that we have, we've done a survey every 6 months since the end of 2011, and there is very little progress on the portion of people who say they have asked about the cost of care or that they've looked for information about the quality of care. Yep. Or that they feel confident they could distinguish between low quality and high quality. So as much as I had hoped, and I think you're my collaborators in this hope, that we would see a real groundswell that accelerated. It really is a slow march, slower than I had hoped.
Well, Wendy, listen, we really appreciate you taking time out of your day and joining us. Very interesting work that you're doing. And
thank you.
To our audience, you can come hear Wendy at IHC Forum West, leading both a workshop on some of these topical issues as well as the general session on Friday morning. Wendy, tell them how they can contact you directly as well. Sure.
The information about the ACE is on the Altarum website, altarum.org, and you go to the center. They have research centers, and you come down to the Center for Consumer Choice in Healthcare, and everything about the ACE is right there.
Wendy,
you can also reach me directly on Twitter at Wendy_Lynch, or you can email me at Wendy. Oh, God, you know how you don't remember your own phone number. You don't remember your own email. Probably the best one is Wendy at lynchconsultingltd.com. consumerism.com.
Wendy, thank you so much. Have a great weekend, and we will see you soon.
Thank you, and thank you so much for letting me talk about our exciting new measurement instrument.
You are welcome. Always great to have you. And to the audience, stay tuned for the next segment of Healthcare Consumerism Radio.